We are excited to welcome Dr. Ashley Raley, an assistant professor in the Department of Sociology at Oklahoma State University and a visiting scholar at the Ursay Institute at Indiana University, where she worked for the previous 2 years. Her work translates research findings into design of evaluation of behavioral health interventions. She has been working with Fayette County here in Indiana over the past years to incorporate insights from her research into activities to address stigma associated with substance use in the county. She also has research that evaluates the association between personal social networks and behavioral health risk among Native Americans, urban adults, as well as examining the role of community social norms for determining policy outcomes for harm reduction programs in Indiana. So welcome, Dr. Raley.
Thank you. I'm excited to be here today to present. This is something that's still kind of a work in progress. So I presented before with maybe some of you were there, but we're able to, I say this in the sense that we're able to kind of move forward and incorporate different perspectives and areas for questions as well. So without further ado though, today I want to talk a bit about what we've been doing in Fayette County to incorporate stigma and more of these foundational research approaches to stigma into what we're actually practicing in Fayette. So hopefully you're seeing my presentation screen now, but I will kind of move forward then and start with, what is stigma? Again, I think we all have experience with the different aspects of stigma and can think of different ways in which we see stigma in day to day. A lot of times we think of stigma as associated with certain health conditions, though it can be more than that. So in order to kind of get us on the same page as we move forward, I want to define it in the way we think about it in sociology and psychology. And so that is really as a social concept. The basic definition of stigma and the stigmatizing process is devaluing and discrediting of others because they possess an undesirable characteristic. So within this definition, we gain a lot of insight into the process, that it involves others, that it really is a social concept constructed and occurring because we interact with others in our daily lives. It involves identifying an undesirable characteristic. So when we're talking about drug use and substance use broadly, we have decided, and a large group of individuals have decided that it goes against what we accept to be normal. And so because of that, it then becomes this drug use and everything that goes along with that becomes a stigma. Importantly, it can happen at multiple levels. So oftentimes we think of stigmatizing others, that an individual holds those beliefs and then it impedes others who have the undesirable characteristic. But we can also see it at broader levels, both within the workplace, or at our institutional policy level, that those can act to incorporate stigma and prevent others from kind of absolving this characteristic or reconciling it with our broader perspectives. So as we move forward, a lot of what we've been looking at and trying to incorporate is this idea that it's at the interaction level, how we interact with others, both our beliefs and our mind as well, and what we think, how our workplace is set up, and then ultimately what policies either promote stigma or can help us combat it. So why we even consider addressing stigma has to do with the implications. It's most basically those who hold a disvalued characteristic. And again, here we're really talking about substance use or even more specifically drug use and opioid use. Those who hold those conditions feel as though they're othered and they are prohibited from engaging in certain activities. But what we actually find in the research aligns with this is that as a consequence of holding broad groups of people, holding stigmatizing views, that there's reduced treatment seeking and lower probability of recovery for those stigmatized individuals, that it can lead to discrimination, so that actual barriers to getting those treatment services or engaging in positive interactions. So there's actual actions that we take to reduce the benefits for those individuals. And then as well, when we're thinking about harm reduction programs or even policies that can help with treatment and recovery, we see broad reduced support for these programs at the policy level. And so to address these consequences that are happening at multiple levels, we can think of some approaches that address these different levels and look at stigma as this social process that's happening between people, within ourselves, and at the institutional level. And so from more the theoretical or kind of the academic side of things, the foundations of the approaches tend to look at three broad areas. So in the first instance, they try and correct inaccurate beliefs through interactions with stigmatized individuals. So there's this understanding that stigma happens at a broad scale because we have inaccurate beliefs about what it means to use drugs or to have this stigmatized condition. As well, and very pertinent to the discussion here today, is that there tends to be a lot of blame that goes with holding a stigmatized condition. So traditionally, we see a lot of substance use disorder treated as a moral failing or as something that we can blame on the individual. And so to combat that, we try and educate on substance use disorder as a disease, so to remove that individual blame. And then finally, also along the lines of education, is that we haven't, as a country and in Indiana as well, traditionally we haven't had the services available to treat and offer recovery services for individuals with substance use disorders. And so by not having those in the past, now moving forward, we want to increase the knowledge about what's available and what people can access. And so along these lines, the way that we tend to approach stigma and address or really promotes one of these three or all of these three approaches is through communication campaigns. Communication campaigns kind of leverage that idea that stigma is a social process, that it's happening on a broad scale with multiple individuals, and that it requires individuals, all these feedbacks that happen. Communication campaigns leverage that by also targeting certain groups, as well as having this broad reach that we can address multiple perspectives. We can reach a lot of people by changing the culture, by addressing what's happening at these different scales. So some of the ones I've put up here are just a few of the communication campaigns, two of which were in Indiana. The Know the Facts campaign, obviously being the statewide campaign. The End Stigma Words Matter campaign was previously run in Fayette County. And then this one on the right, a newer campaign across multiple communities in the US that's run by NIH and a larger grant there. But what each of these campaigns is doing is slightly different. So the Know the Facts campaign is really focusing a lot on the facts, on the education aspect, and not treating substance use disorders as an individual failing, but also promoting the available resources out there. The Words Matter campaign focused a lot on person first language and trying to adjust the way we talk about substance use. And then finally, the one on the right, this broader one, is really using those narratives, those personal narratives, to create empathy and try and take the multiple identities, the perspectives that individuals have, and play up those different perspectives instead of focusing on othering or the substance use disorder specific. And so each of these campaigns has different objectives, maybe was treating or addressing different attitudes and beliefs within the community. Also different scales. We can think about a statewide campaign versus what's currently going on in our community or across multiple communities. And so our approach then was knowing that there are a lot of efforts being made across Indiana and even in our own community in the past to address stigma. We wanted to hone in more on those specific characteristics and specific attitudes that maybe we're still missing. And so to do this, we are launching a campaign, hopefully in the beginning of the new year, to address both these individual level aspects and more broadly the social determinants of opioid use disorder stigma in Fayette County. And actually I should address this or change this, but we're looking not just at opioid use disorder, but substance use more broadly. And so the way we want to tailor this to Fayette is to incorporate local data and evidence. We want to leverage local expertise. But then at the end of the day, we also recognize that a communication campaign is a marketing campaign. We want to promote our idea of what needs to be combated. And so if we want to really sell that, we want to bring in people who are great at creating these stories that can match the evidence. And so I mentioned that this is Fayette County that I'm working with. And just as a brief overview, if you haven't been there, it's considered a rural or semi-rural county. It matches a number of other counties in having kind of that broad or that large central town and then smaller towns around it. So Connorsville being the central hub and where the organization that I work with, the Connection Cafe, is located. The population of the county is about 23,000. Unemployment rate tends to be around 6%, and it's predominantly white. When we think more specifically, though, about Fayette County's trajectory and history and relationship with drug use, in the past, it was similar to other rural counties in Indiana that had major factories. We saw these close, high unemployment, coincided with increased substance use. The community then had a syringe exchange program for a while, though the history with that overlapped with increases in heroin overdoses, Hep C cases, and drug-related incarcerations. As well, at this time, we saw a number of physicians who were arrested for overprescribing. So the original syringe service program was met with stiff resistance and continues to see that stiff resistance within the county. Recently, it's been brought back and been extended to look not just at syringe service provision, but broader services that can address the entire recovery journey. And this is through, again, my colleagues and partners in Fayette, the Connection Cafe. And so in 2022, a few months ago, the Connection Cafe actually became a 501c3, and so is able to also be extending their services. So I say this too, because as all this is happening, we need to keep in consideration the history, but then also where we're moving forward and what we want to achieve. So with these extension of services through the Connection Cafe, we wanted to take this campaign and really implement it and embed it within the existing programs and goals of the cafe. So for our implementation approach, it's very much a combination of community-based research and community-based implementation, but with a slight marketing twist to it. And so what this really means is that in the preparation phase, we're using multiple data sources. We're relying on expertise from the community, from the researchers, so those of us at Indiana, and then also working with a professional marketing group that's outside of these two groups. This falls into the planning stage as well, that we're both preparing the materials, looking at the evidence, and then planning, going through a iterative process of developing the messaging, addressing the target audience, and designing these materials in a way that works for our community. We further take this approach in the implementation stage, very much following with that community-based approach by having the community distributes the materials, but continuing to have that technical guidance from the marketing team as well as the IU team. And so finally, too, though I won't touch on it as much today, in part because we're not at that stage, but we have, as we go along and set up these different approaches, or these different steps of the approach, we want to make sure that we can evaluate it at the end of the day. We want to make sure that we're getting that community feedback about whether this campaign is viewed as acceptable, but then also tracking changes and evidence that we can use down the line to improve the campaign or to pivot towards a new approach. So I'm going to start with the preparatory phase, which is really just analyzing the relevant data. This area is where I've been most involved as one of the researchers, and so I can speak a bit more to how, if it's unclear at the end in the Q&A, how we've taken the data and translated it into practice. So first, from the Indiana side, we have this unique survey data that was commissioned by researchers at Indiana University on the entire state of Indiana. So we have 41 out of 92 counties where we have representative samples. We have about 224 people who responded to the survey from Fayette, and it includes responses on beliefs and views towards substance use, general health practices, and just basic demographics. We also have, to complement this, interview data that some of my colleagues did with individuals and more specifically stakeholders within Fayette County. So they did 33 interviews and 2 focus groups with health practitioners, politicians, law enforcement, and people with lived experiences. To complement this, we then have the community expertise. Once we started analyzing the data and looking through it, we had the community, we set up a work group that could interact with myself and others about how we were interpreting the data, their responses to the findings, as well as building off and asking additional questions to look into. What about this? How might this incorporate into your findings? And so we still have that work group, but now that we're about to launch the campaign, the work group is less active, and in the sense that it's transformed into a different type of work group. And so towards the end, when we had gotten the findings and the research in an area that we felt really represented what was going on in Fayette, we brought in marketing experts. For them, we were able to tell them this is what we're finding, this is what we're seeing, here's some of the data cleanly laid out. And then for them, they could add that creative side. We did monthly meetings with them over about a 6-month period, as well as additional emails, et cetera, to talk about story development. So here's what we see is happening. Here's what the evidence says. Here's what the data says. Here's what the community says. What does this look like in a story? And so this, I would say, has been a challenging aspect because we are really bringing in 3 different perspectives, and a lot of times they're different perspectives that need to be reconciled. And so we're still working on finalizing some of that story. But I want to run you through some of the data and what that looks like. So from this survey, we had a number of questions related to stigma. The ones here are part of a broader toolkit, so to say, that can get at whether it's stigmas coming from the desire for social distance, whether it's coming from misunderstanding, whether it's a disease or personal failure, as well as understanding what types of treatment or options are out there and whether you're open to treatment or more broadly recovery. And so I've only have here a few of the measures because these are the ones that stood out to us most. These are the ones that we can say Fayette was ranking quite high on, as well as showing differences compared to the rest of the Indiana. And so these ones when we're asking about whether they endorse stigmatizing views related to marrying into the family or having people who use drugs as a neighbor or socializing with them, these ones we see in the blue bars that are much higher than the rest of Indiana. So they're the ones where we have cause for concern that these beliefs and endorsing these views is not what we would expect, especially when we look at broader Indiana. So when we dive into the interview findings, we can see more that a lot of these findings not only is analyzing or looking at Fayette specifically valuable, but that it's tied to these community concerns and that the entire community associates itself with drug use. And so without reading the entire quote, this person has said that when this community has a reputation for drug use and then businesses are trying to come in and get people into the community, it makes it harder to do. Because we have that negative publicity that comes along with, 20 overdoses in 20 days for a 10 to 10,000 people. We also find that knowing someone is not enough. So at the beginning, I've said that a lot of the research and a lot of the practices that come out of the research focus on just exposure to people who use drugs or the stigmatized condition. But what we find is that that's not really enough. People in Fayette County already are very familiar with drug use. A lot of them, and this is actually reminiscent of all of Indiana, that around 45% in Fayette, as well as that number is very similar in Indiana broadly, know someone who misuses drugs. What is unique about about Fayette is that there's a large portion who are family members and close friends. So we would assume that there's already this positive contact here, but in fact, what we find is that we need to focus more on addressing the interactions that we have and the activities we have to make that contact more positive. And so in part, when we say knowing is not enough, what we see with the interviews is that substance use is close to everyone. So this example talks about somebody or multiple people who work in the hospital, but then they also live in the town. And so there's this sharing of information that goes along as well, such that in a matter of time, hundreds of people know in Connorsville, and we've got a few thousand in it. So. Finally, the last major point that came out of the survey and interview data was that stigma influences public support for treatment. This graph here shows that as we, as we go from the left to the right, that stigmatizing beliefs are increasing. So as they increase, support for medication, for opioid use disorder decreases. So there's this disconnect so as we see more stigma, we also see less support for treatment. And in part, we see that treatment support maybe isn't so much out of a complete disregard for recovery or options for recovery, but a shift to focus on the institutional role and treatment concerns more specifically. So this quote says, "I do not agree with just unending government sanctioned drug dealing." And they go on to talk about how doctors, when they want to step down my methadone dose, doctors are saying, "Oh, no, you're not ready. No, you're not." And so they've said that they've heard this from a lot of people. So we took these survey findings and the survey and interview findings and had our work group in which we could discuss both the findings as well as discussing what some of our options are to address this. So when we went to the work group and talked with them, we focused on, okay, given these findings, why are we seeing these? But then also, what else are we seeing? Do we see other, specifically with these ones, other campaigns? What do we like? What do we maybe not like? And what will work for us? So when we ask, what do we like? There's that diversity of experiences, the parents and family focus, and the personal testimony, which indeed matches with our findings that these parents and the family, or that these close relationships we need to really look into. What do we dislike? Focus on treatment and not recovery. So it was actually through the work groups that we started to see why stigma and treatment are related, but maybe looking more broadly at recovery. As well as in Fayette, there was acknowledgement that using too much of the medical language or jargon might not be helpful because buprenorphine and other treatment options are fairly new there, and nobody would know what we were talking about. So when we think to what will work for us, there was general agreement to show Fayette people. So they like this idea of showing people in their multiple identities, but they actually wanted it to be even closer to home. The Together We Can motto that the Connection Cafe uses more broadly, they also wanted to incorporate into the campaign. And then again, have these diverse views in using the videos that we can put on social media or as well run as commercials. So I will briefly mention as well that as we were talking through the data and the findings and working with the community, we are also upheld to our stakeholders and to the funding for the project. And so trying to think, how would these fit through into our different work plan objectives, those broadly being treatment and recovery, law enforcement, and workforce development. So as we tie together the findings, some of what we see is that knowing someone is insufficient, well, that provides us with this opportunity to create empathy, to look at these relationships that are struggling, to draw on those empathetic understandings and create more opportunities for empathy. When we think about concerns for community reputation, the fact that stigma seems to be tied to the entire community, we want to counter that by promoting and mobilizing the community's assets. So thinking as a positive, what does the community have to provide? But then even further in this third point, with the relationship with treatment, we want to educate on the existing culture of prevention and recovery, so that it's not just about treatment, but that there's lots of options out there and there's already an existing culture. And so the content that the marketing campaign came up with is this connection is hope idea. It provides hope. It can offer the culture and linking everyone together. The string is the link that we were carrying throughout our materials. And then having that purple to signify recovery health. And you can see here too, we say together we can end substance use disorder stigma. There's a thread that connects us all. So tying in the Connection Cafe's tagline as well. So finally, when we're actually going to implement it now, we're thinking about having that widespread distribution. So incorporating multiple different offerings, different ways to reach people where they are. For targeting, we are focusing on those who can provide that social support, those who would be proponents of positive contact and then can disseminate that through their networks, as well as those who are champions in the community or leaders who others can view as being part of this campaign. And so broadly though too, our call to action is to join the movement to end stigma. Again, we're trying to mobilize that existing support, bring everybody who's already working together into a more visible position, and that they are not alone. So there is an existing support community. We can provide those positive resources, those positive connections. We just need to bring it all together. And so I will, in the kind of this last slide, in a second, I will focus mainly on this boots on the ground, dive into that a little bit more, though I can address questions on the social media, the posters, the billboards, or the trainings. But the boots on the ground I want to emphasize because that's the day-to-day. That's what the Connection Cafe and those who are in the community constantly have to face, and they constantly have to be the faces of the campaign as well as other objectives that align. And so what we've done is suggest that we have this cafe. We're lucky to have a physical location that provides this judgment-free space, but that we also can do outreach at the same time and have seen significant increases in the outreach that is part of building those connections, part of meeting people where they are, but also letting them know what services are out there and starting to show that these connections exist. On top of that, with the services, we've increased the services and then offering more support groups. So the support groups really looking at those who can provide that positive connection and how they can provide that. And then finally, with the syringe services, I put a quote here, but as you all who are on the ground in the communities know, you always tend to have those quotes or those few policy facts in your back pocket that they can pull out when they need to talk about and garner legitimacy for their actions. And so this one here specifically related to syringe services. And again, I'm not going to dive into exactly all the methods we have for evaluation, but this is something moving forward that we have set up so that once the campaign is launched and afterwards, hopefully we'll see if we've really made the impacts we want to. And so thank you again for listening and for being here today. I know that there's the change in time might have affected a number of people.
Thank you, Dr. Riley. That was really very interesting. I'm going to open it up to individuals that have questions right now. And if you could unmute yourself and ask those questions. I do have one. I'm going to go first since I'm already unmuted. What was the like the deciding factor to go to that community was, I know you mentioned those couple of things, but was there grant funding that allowed you guys to do that?
Yeah. Yeah, so to go back to the very beginning, it was really Charmin who is now the executive director of the Connection Cafe. She had actually, I think, fortuitously connected with a researcher at Indiana to kind of strengthen the work she was doing on the ground already, essentially look for additional grants. And they had at this point already done their initial Stigma campaign. And so actually the campaign it's part of this HRSA RCORE grants, RCORE implementation grants. And it's only one component. Those objectives cover a few of the additional components. But we took this opportunity to incorporate data in order to strengthen the launch of the campaign. So short answer, Charmin reached out to researchers at Indiana who have a ton of information about and can access a lot of this data. And then we kind of came in to help guide throughout.
Thank you.
Yeah.
Charmin is a powerhouse, I think. So
yes.
Anyone else have any other questions?
So I'll say too, I can provide both my Indiana email as well as my Oklahoma State email. Either one will work. If you come up with questions down the line, I know a lot of times later people are interested about measuring stigma. And so we've kind of thought through, we were very lucky with this survey to have some validated measures that are used a lot in academia. But we've also found that they match quite nicely with easier or more direct measures of stigma that you can do within your own community.
Wonderful. Well, thank you for that information and for taking the time to be a part of our presentation in the Indiana Coalition Network.
Thank you for inviting me.
Is there any way that you could put your contact information into the chat in case? Oh, you already did. Thank you. You are on it. All right. I'm going to go ahead and do a call for roundtable presentations for December. This is your opportunity to showcase what you guys are doing in your local communities. So far we have CEAS of Scott County that is going to kind of do a little recap, 5-10 minute recap of what they were able to do this past year at their in their community. And Chase Cotton, I hope I'm saying his name correctly, from Hendricks County is also going to participate. And if you know of a county that you would like to have them talk more about what they're doing in their community, that would be great. Just reach out to one of the ICN teams and we can reach out to them about participating. I noticed that Janet is on. Janet, do you have any updates from CJI?
Hello, everyone. At this time, I don't have any current updates. This is just a friendly reminder that Q3 will be opening within the next couple of months. I'll be working on some step-by-step instructions for the LCCs and their coordinators. But otherwise, everyone stay safe, be well.
Right. Thank you. Everyone have a very blessed Thanksgiving And we'll see you next month on December 22nd.